When they're saying that I was getting a hip replacement, I was excited. You know, many people have had them and they're up and walking in 4 days. I woke up probably about 3 weeks later. This leg was not attached to anything. It was just muscle. There was no bone holding towards any part of my body. So this was just going to rot away.
The operation he had at the outside institution is called a girdle stone procedure, which is something we usually do when someone has a very bad hip infection, or if someone is a paraplegic already in a wheelchair and they don't walk and they have something wrong with them, and it's done for palliative pain control. And so this was done for him for the condition that he had, which was neither of those. And so this again left him without a hip joint, and so he was relegated to being in a wheelchair with his leg just sort of hanging there.
They didn't know what to do, and all they could do was feed me pain medicines. That's all they kept on doing. We went and got a second opinion. That doctor turned around and said, "This is terminal and it's irreversible. You cannot fix this." We didn't give up. We went one more place. You know, I had a chip on my shoulder walking right into his office like he's going to tell me the same exact thing here at UofL. There's no way to fix it. And all of a sudden he looked at me and he said, "Well, let me put my detective hat on." A week later, his secretary contacted me and said, "Dr. Andy is going to take your case and he wants to do surgery next week." And I'm like, what?
Having South Hospital is a huge asset to this community. We have all of the resources and technology of the university, and we're able to perform big operations like this at this hospital right here in this community.
He built my hip and built my ball joint in the next. And it's unbelievable that he did it. And you know, you just want to jump for joy, like, how did he pull that off? And he did it. I volunteer with the Honor Guard, and we do the 21 gun salutes for our fallen heroes and our veterans. I wouldn't be able to be a part of that team in a wheelchair. Dr. Andy gave me the gift to be able to stand, and now I'm able to stand and salute with pride and honor.